Thank you very much, Prof, for your time. Just tell us very quickly, how do we find ourselves here? I mean, we do know that Gauteng usually leads with infections and then dwindles a little bit later. But how did we get here so quickly?
First of all, thanks for having me. This is something that is not unexpected. We need to have in mind that on November 1st, we had a major super spreader event, which may have served as the trigger that led to what we have today. As a matter of fact, 2 weeks after the November 1st elections, we saw the first significant increase. Now, in addition to that, we have, as already indicated on Thursday, by the Department of Health, a new variant, which appears to be significantly more contagious. And as such, we have a strong acceleration in the numbers. So we need not panic. We need to adapt quickly to the new reality, just like we did when something similar happened before we reached the peak of the third wave. Remember, the Delta variant became dominant before the third peak took place. So what we do is we basically activate a plan, a bunch of mathematical models that are dynamic in order to adapt to the new reality. And we've learned a lot. Believe it or not, 2 days is almost an eternity when it comes to this kind of thing. So we have already presented yesterday very preliminary, but yet preliminary modeling as to what we think is going to happen in the province in the next few weeks, in light of the fact that this variant appears to be more contagious. Another very important input that we need to take into account is the fact that if this variant were to be very lethal, or the vaccine would not be effective at all, we would already have seen a significant increase in mortality and excess mortality, which we don't observe. So all those numbers are absolutely critical for us to input them into the modeling and make the appropriate predictions, which will become much more accurate next week.
So what do you predict, Professor, to happen in Gauteng and the rest of the country in the next coming weeks?
So as far as Gauteng is concerned, it is evident that we are undergoing a strong acceleration in the numbers. In fact, a level of acceleration and growth that we haven't seen before in the pandemic, which is indicative of something that is more transmissible. What this essentially means is that the peak will be moved forward. The peak of the fourth wave will actually happen earlier because the transmission is very fast. So the first preliminary calculations that we've made indicate that the peak will happen somewhere between mid-December and end of the year, as opposed to, after the new year, should the virus not have been as transmissible as it is today. And that's in a nutshell the impact we have right now. Now, what is very important now in the next few days, up to a week, to understand is what is the exact level of reinfections, what is the exact level of hospitalization and mortality that we observe with the new data, so that we can be more conclusive as to the real impact of the pandemic when it reaches a peak, its fourth time.
So you advise the Gauteng government when it comes to the different peaks that we reach, etc., Prof. Mellado. During your advice to them, you obviously also advise the health MEC. Is our health system ready for this peak, for this fourth wave? So,
as I said, we are crunching the numbers as we speak, because in light of the new variant, we may have changes in what we think will be the level of hospitalization. So I wouldn't like to venture to say that right now, how many we will have. Our rough estimates to date indicate that it's very likely that the province will be ready, that the number of hospitalizations will be less than the ones we had during the third peak. But yet, this is a very preliminary estimate, as the numbers that will be streaming in this coming week will be absolutely essential to really have a much more certain statement as to the level of severity that we will have during the fall.
So, Prof, are we in the fourth wave, particularly in Gauteng? Have we gotten into the fourth wave now?
So the statement that we make as a committee is that we believe that we're going towards the third wave. We don't want to get into an academic discussion as to what is a wave and when to declare it. I think that's something that belongs to the realm of academic discussion. We believe that the numbers are high enough and that the acceleration is strong enough to believe that we're going towards a fourth wave.
Just very quickly while I have you, Prof, and you can let me know if you can't answer this question, but you did mention a little earlier on that with what you're predicting and with what you're seeing at the moment, there is efficacy still for the people who did go get vaccinated. At ENCA, we are encouraging people to get vaccinated, but of course, the vaccine that is available at the moment is the one we've had since the second and third wave. Is it still worth people going to get vaccinated with the exact vaccines that we have in the country? Will it be able to fight this new variant?
As I said earlier, I mean, we are now trying to understand the numbers, but what we can say at the moment is that if the vaccine was not efficacious, if there was no efficacy at all, if this new variant were to escape completely, we would see a completely different picture of mortality as we speak. Okay. So this basically indicates, and there I agree with the sentiment expressed by the Department of Health, that the vaccination and the vaccines we are taking are expected to be efficacious against the new variant as well.
All right, Professor Bruce Mellado, thank you so much for your time here on ENCA.